Everyone, I'm Dr. Malia Jensen. I'm a board-certified family physician. I'm located in the United States in Iowa. I want to welcome you to our live Q&A. This is your opportunity to ask health questions. We're waiting for everybody to come on, but before we dive into today's topic, you've probably heard me talk about the medical buffoonery that we've all been fed for years. And my mission is to make sure that you are no longer bamboozled by the buffoonery. To keep that mission front and center, I have developed a line an apparel line that has some t-shirts and hoodies and that sort of thing that say no longer bamboozled by the buffoonery. So check it out if you'd like to, and maybe wear one of the t-shirts or hoodies or whatever to your next doctor's appointment. I'm sure they'll get a kick out of it. So yesterday, oh, and by the way, I want to thank you guys for being here, because I think when I see you guys here, I think about how you are investing your time in your health, and I think that's really neat. So yes, to get into today's topic, yesterday we spent a good chunk of time talking about GLPs and how they can be basically a metabolic trap. If a person is taking a GLP, losing a lot of weight, not exercising, not lifting weights, not building up their muscle, not eating enough protein, basically nutritionally malnourished. It's a pattern we see across all of medicine, not just with the GLPs. We use a pill to quiet a symptom while ignoring the root cause. And so that's where I come in, and I'm trying to help you and provide you information that can help you make decisions with your physician. I'm not your physician. This is not medical advice. It's for information purposes only. So today, we're going to look at the exact pattern when it comes to mental health, specifically using an SSRI without a foundation like EMDR or cognitive behavioral therapy or cognitive processing therapy. This is the foundation. Just like with obesity, the foundation is diet and resistance training. So again, yesterday we spoke about GLPs. Today we're going to talk a little bit about SSRIs, and I want to get your guys' opinions. You know, research shows, if we specifically look at depression, research shows that metabolic disorders like insulin resistance can actually double your risk of depression and anxiety, double the risk. So as a physician, informed consent means that we're telling patients about best outcomes instead of just reaching for our prescription pad. I think that it's a field of medicine called metabolic psychiatry. I really think it's an up and coming field, and I think over time it's going to be more and more important. There are a couple of physicians that I follow that are into metabolic psychiatry, one being Dr. Chris Palmer and another being Dr. Georgia Eade. And both of them speak to diet and exercise. But specifically, I think they're more along the lines of diet. Just like yesterday I spoke about GLPs and it mutes the hunger signal. How about SSRIs muting the button for, emotional pain or, our depressive symptoms? Again, we're taking a pill that helps with symptoms, but yet is missing the foundation of maybe peeling back the layers of the onion and figuring out where is or why, what's the underlying cause of people's depression. And a lot of times that can't be sorted out unless we're going to therapy. And I'm a big believer in therapy, okay? So what needs to be done is building this foundation with, like I said before, cognitive behavioral therapy, so CBT, or CPT, cognitive processing therapy. or EMDR, which is basically eye movement desensitization and reprocessing. That's what that means. EMDR, eye movement desensitization and processing. Okay. I think that it's important to tell patients that the medicines that we're using is just a bridge. It's not the destination. How do you guys, what do you guys think? Or, do you just go to the doctor, you say you got depression, they ask you if you're suicidal, and then you're not, so they give you the SSRI and don't really get into, not that they even have the time, but they don't get into asking, what's going on? I get it. Family practice, if that's what you're using, is not, they're maybe not trained as much in psychiatry or in mental health, but really it doesn't excuse them because they're the ones that are actually writing the prescription. So you can't really claim negligence if you wrote the prescription and then said, well, you know what, I really didn't know what what was their underlying problem. Well, did you note that you were going to send them to therapy? Well, I forgot about that. But we mentioned it in the office visit. Well, yeah, but you didn't document it. So if you didn't document it, you didn't do it. This is tough, you guys. I just think that the bridge with depression, I think the data is going to come out more and more this year and into next year, where we are looking at metabolic dysfunction as the risk for depression. I'm not saying it's the whole risk. Again, that's where the therapy comes in and unpeeling the layers. But following a crapola diet is only going to make your symptoms worse. Okay. Let's see. I don't see that I have my moderators here yet, so I'm trying to clean up some of the, I'm live on YouTube and Instagram. So it's the YouTubers that we get a little bit of riffraff on there. And that's why we use our moderators. So Dr. Money represents, D-Money represents, sorry. Diet is critical. So I agree. We have, if we are only muting the sadness part of things with an SSRI while ignoring the metabolic debt of poor nutrition and even muscle loss, because you're, probably not working out, we simply just get trapped in a cycle of treating symptoms and then ignoring the body's overall health. Does that make sense, you guys? Yeah, D-Money, I would agree. Eliminate alcohol. That should be a given because alcohol is a poison. There's nothing good about alcohol. It can never be good. It's always a poison. Lucky says, I actually completely agree. Diet is so important for mental health. So it sounds like you guys are agreeing with the concept that it is real about a psychiatric disorder. Okay, we can all agree on that. We can all agree to symptoms of sadness and blues and fatigue and anhedonia, where we just don't feel like doing anything. And I think that puts us in a trap where when we feel like that, we don't go exercise and we don't really monitor our diet. In fact, we will eat things that trigger dopamine in our receptors that feel good. So we actually cause a domino effect, a circular loop that's just feeding more symptoms. And I guess the point I'm trying to make is that doctors, from my standpoint, you guys might be seeing it differently and you have a wonderful PCP. But from what I'm hearing from people, The doctor is either diagnosing you via a piece of paper and a lab result, or the patient actually comes in, says, I'm depressed, my brother is on Zoloft, do you think that would be good for me? And the doctor, wanting the easy way out, will just go ahead and prescribe the medication and call it good, without really getting into, hey, what is your diet? Hey, what do you think about therapy? Let's unpeel the layers of the onion to figure out, why are you depressed and anxious? Are you sleeping okay? Are you getting outside? Is work bad? I mean, there's so many things. How did you grow up? All of the things that I think healthcare is so bogged down with, seeing so many patients. And that's a way to make money. The more patients a doctor sees, the more money they make. And that incentivizes in and out without really getting to know the person, the patient, and what's going on. And then we wonder why there's so many suicides out there. In fact, this is crazy, but I believe it's true, is that a person who's thinking about suicide has seen their primary care physician within the 30 days of committing their suicide. Doctors are missing this, okay? That patient may not have even come in with depression stuff, but the reason they came in is because they were seeking some sort of reassurance and help and couldn't ask for it. That's what's really scary, okay? One other thing, and I think somebody mentioned it here. D-Money is talking about fats, and D-Money, if you could state that a little bit later when I get done here, I want to go into that, about the different types of fats, okay? And I maybe want to tie it in with the lipid hypothesis and coronary artery disease. But first, let's stick with this mental health. And I agree about the fats and the brain, okay? But I just want to maybe tie that into with something else, okay? And Locked on West, I will also get to your question if you remind me. Okay, so when speaking about the diet, especially if it's, I call it a crapola diet, okay? It's an inflammatory diet. It's full of processed foods, seed oils, and sugar. When we're eating that stuff, we're actually causing inflammation in our gut. We're causing gap junctions in the cells lining our gut. Usually the gut lining has cells that are very tightly bound together. When we eat an inflammatory diet full of processed foods, seed oils, and sugars, we cause what we call gap junctions. So what's inside the bowel can escape outside. And that causes symptoms all over, systemically, joints, skin, eyes, everything, okay? Another thing I want you to be aware of is 95% of the serotonin receptors are in our gut. So if those receptors are not working very well because they've been messed up by your diet or a leaky gut inflammatory situation, no matter how much serotonin via SSRIs, Zoloft, Paxil, Prozac, all of those medications, Lexapro, all of those SSRIs, no matter how much you're taking, if your gut is not healed or not functioning well, then those serotonin receptors can't really accept the serotonin that you're feeding it orally. Again, it's one more reason why the doctor should be asking about the diet. Hey, what are your symptoms? Are you having bloating and gas and abdominal pain when you eat? Oh yeah, doctor, but I came here for my depression. I know, exactly. I'm trying to see if your diet is one of the causes. You could have normal amounts of serotonin, but your gut receptors, which is 95% of where the receptors are located, only 5% is in your brain. 95% in your gut. And you say, no, I think I'm low on serotonin. Well, you're not really low on serotonin. Your receptors are not working well. And so they can't see the serotonin. They could be downregulated. They could be messed up, damaged. if we don't ask the questions about the gut-brain barrier or the gut-brain axis, we have to think about one other thing as well, okay? When I think as doctors, we're missing these things. We're also missing cortisol. Again, we're jumping to the SSRI, but we're missing cortisol. And when we are eating kind of a crappy diet or we're stressed, cortisol goes up, right? Cortisol goes up, blood sugar goes up, insulin goes up, belly fat goes up. We're damaging our gut. Again, where all this, the serotonin receptors are located. Is this ringing true with what you guys are seeing? Okay. Constantine says definitely. Prismo says, I would definitely tell my doctor about the way I feel. And since I trust her, I would believe she would refer me to a good therapist or at best, put me on the path to mental health wellness long term. You trust her to do that because she's shown to you that she has done that for you before, or are you speculating? I'm curious. I'm not putting your doctor down or you down. I'm just curious. Has she done that for you in the past? So she's got a history, or you just think that she's a kind, generous person and she's going to just automatically make that decision? Okay. I'm reading your questions. D-Money says depression is a demonic force. I can get on board with that because this world tickles our ear all the time. We live in this world. But if you are a Bible-believing Christian, you're not supposed to live of this world. It is, because we're sinners, it is human tendency, human image bearers, to be bamboozled by the world and what it is telling us. And that is very distracting. Like I said, it's tickling our ears and saying, Satan says things as a lie that we maybe want to hear and cannot distinguish or discern good and bad, okay? D-Money says, do you like kombucha as a regular thing? I tend to stick and avoid any type of plants. And we have to be very cautious when we recommend any type of fermented product to a person because we don't know what their histamine status is. If we give or recommend any type of fermented product, we could be increasing mast cell destabilization. Okay, and we just have to be cautious. Let's see. I'm trying to read through your questions. Put a Q, if you could. I don't have a moderator right now helping me out. So if you could put a Q in front of if you have a question. Let's see. Prismos, I did not know that, but thank you for the confidence. I appreciate it. D-Money says, what effect does fasting have on gut health? Anytime you're not eating, D-Money, your inflammation is going down. It's not as much, although I'm a big believer in fasting, because I think that autophagy is very important to clean up cells, to clean up debris and bad parts of cells. Autophagy is very important. Autophagy will, as a resting, it's going to improve inflammation. What is more important, I think, than actually the fasting aspect is how you end the fast. So if you fast and you say, oh, I'm going to get some healing and I feel great, and then you end the fast with crapola, then you've actually caused more damage again. So hopefully that helps. That was a good question. VJ, I don't know the answer to that, but maybe you can look it up and let us know. Good morning, Kashua. Retail My Ride says lots of evidence walking around in society today, physically unhealthy and mentally unhealthy as well. I would agree, which means all the more that we need to set a good example and try to help others that are around us. Would you agree with that? So since I have a little bit of quiet time from you guys, I know this is a tough subject when talking about mental health, and admitting, even as a family practice physician, that I have probably let people slip by without noticing that they were coming in and they were hurting because they were unable to say so. Even though the N of one patient said, if it was me, I would, my doctor would listen, and she's great, and we've been seeing her for many years, and my family goes to her, and we just trust her. Okay, let's just say you do trust her. She didn't recommend therapy to you. You would trust that and say, well, I guess if she didn't recommend it, I don't need it. Is that, because that's what I'm hearing you say, Prismos, okay? And I don't think that is a good plan of action, okay? I think everybody who's got, you put them on an SSRI, the doctor needs to recommend therapy, okay? I just see that as the most important thing. Pouncing says, what role does sunlight play in how we safely implement more? Safely implement more? More what? More what? Help me out, Pouncing. And Kashua, thank you very much for your donation. If you guys are on Facebook, I do have a live donation for Rescue, Rehab, and Rehome. It's where I got my tallow. And on March 11th was our anniversary of our Gotcha Day for 1 year. So yeah, I've had him for 1 year, and he's been a true blessing. A lot of ups and downs, but for the most part, much more blessing than not. Pouncing says more sunlight if it's beneficial. I believe sunlight is beneficial, but now you're going to go against all of the people who tell you to put on sunscreen. The minute you put sunscreen on, now you're blocking the beneficial aspect of the sunlight, okay? Granted, when it comes through our eyes, Pouncing Puma, that's great, and it does help. We're getting blood flow to our body, to our brain because of nitric oxide production. It's also natural. We're in nature when we're getting sunlight. I can't say enough about sunlight, but I know that if there was a dermatologist listening right now, as a mouse in the corner of the room, they would be encouraging everybody to put on sunscreen or stay out of the sun, wear a lot of clothing, block the sun rays, do this, do that. And I believe we're missing a lot of the beneficial aspects of being in the sun, okay? What is a good amount of hours to fast, or at the least amount? I think a 16-8 intermittent fasting is good if you don't want to go for the 24-hour or 48-hour or 36-hour fast. A 16-8 protocol is a good thing. That would likely include about 2 meals a day. Susan follows Rescue, Rehab, and Rehome. Thank you. If they were listening, I bet that they would be tickled about that. But yeah, I think a good 16-8 fasting program would be good. But throwing in a couple of 24 hours, those are really pretty easy. Say you eat at noon and noon, okay? That would be, a 24-hour fast. And I think most people can do that. I really do. okay? The 48 hours might get a little much. I don't think I've ever done a 48-hour fast. Not that I recall, unless I was sick. And then that's really, really easy. And I haven't been sick for, it's been over 10 years. What do you know about saffron supplementation instead of prescribing SSRIs, since there are recent studies suggesting that it is beneficial as a medicating with SSRIs without horrible side effects? I don't know. Saffron is a spice, and I don't know its indication for depression and anxiety, but it sounds like all things crafty. Have you tried this, and has it worked? Because that would be something, even though there's no clinical studies, studies of you guys talking about it, I think are very important. I'd rather hear about you guys' studies than some study I read on PubMed that I don't know if it's fake or not fake, okay? But if you've tried saffron and it's helped calm your spirit, then I think we want to hear about that, okay? But yeah, I agree, hearing a study about saffron and either calming the side effects of SSRIs and the nausea. My question would be, because these receptors are in our gut, that is the side effect, is nausea. That's why these medications cause nausea, is because they are trying to stimulate the serotonin receptors in our gut. I hope that your serotonin receptors are healthy, but that's where diet comes in, okay? Jack says, how does low vitamin D elevate hemoglobin A1C? Jack, I answered this question yesterday, and I would have to look into this, and I've totally forgot, Jack, and I apologize. When I walk through low vitamin D, I actually sense a lower hemoglobin A1C, in fact, falsely low. But I would have to really dig deep into that in fact, if I have a pen here, I do. I'm just going to take a note here and say, so low vitamin D and high A1C relationship. I'm going to look into it, Jack, because I don't know that answer, okay? What is the time and what is the relation of time in the human body? VJ, I don't know what your question is. Please help. I don't understand what your question is. And again, VJ, I don't understand your question about 7-stage mind meditation or mediation. You have mediation. I'm not sure what you're referring to, but it sounds like, these could be questions that, you could look up yourself. Okay. What do we got here? D-Money asks, are there certain minerals you find many people are deficient in? It would depend on their diet, D-Money. I can speak to, okay, let's say the extremes diets are the ones where they're going to be the most deficient. If you're looking at a vegan, for instance, they're going to be low in some vitamins like your B vitamins. They're also going to be low in absorbable amounts of iron. They're also going to be low in vitamin A. They're also going to be low in essential fatty acids like omega-3. But most of these people, D-Money, if they are vegan, most of them, I don't want to paint a big, broad brushstroke, but most vegans who are thriving vegans already know these things and know that they are low on certain things, or know to take B12, for instance. They know to take algae oil for the omega-3s. they know that beta carotene has a poor conversion to vitamin A. I just can't see them as being dumb people. I believe that they study this enough that they're not going to make these mistakes. Although we still need to check their levels just to make sure that even if they are supplementing, that they're supplementing enough. Now, if you're eating a standard crapola diet, you could be, even though they're fortified, all the diets are fortified, they're fortified with junk, okay? You might not be able to absorb it. Just like a vegan, they might not be able to absorb their iron. So they go to their doctor, and the doctor says, you're anemic, meaning in their terms, anemia means low iron. So what they do is they give them synthetic iron, which is more non-heme iron. So non-heme iron is in plants. Heme iron is in animals. So if a vegan is not eating animals, they're not getting heme iron, which is easily absorbed, at least 30%, versus non-heme iron, that's 3% absorbed. So their doctor will say, hey, it looks like your iron levels are low, your ferritin's levels low. Then here's more iron, but they're giving them to them in the form of more non-heme iron. Then they'll tell them, just take some vitamin C, which is an antioxidant. So now you're giving high doses of vitamin C to get them to absorb their iron, but in the process, their high vitamin C and D and zinc lowers their vitamin A even more because they're eating beta carotene as their source of vitamin A. And in all reality, their thyroids are probably down. Why? And what does this have to do with beta carotene? Well, in order to convert beta carotene to vitamin A, you need an enzyme or a breaker downer called BCOM. In order to have enough BCOM, beta carotene, to break it, that enzyme to break it down, you need T4. But if their eating has taken a hit on their thyroid, then they're low on T4, which converts to T3, which is the active form of thyroid hormone. You can see where these extremes of dieting are not good or can be a problem. But as long as the person doing the extreme dieting is educated, they're going to make good choices. Okay? Now, on the other extreme are the carnivores. If the carnivore is only eating muscle meat and not organ meat and not collagen and not nose to tail, basically, okay? But especially organ meats and collagen. It's not a vitamin deficiency I'm worried about. It's actually an amino acid problem. That's just one aspect, okay? Now, why is that? If they're only eating muscle meat, they are eating a tremendous amount of methionine, an amino acid. And methionine has to have glycine on board to neutralize the methionine. We need that amino acid. I'm not saying we don't. We need it. We just don't need as much as we're getting. So our body has a natural neutralizer. It's called glycine, another amino acid that is supposedly non-essential, meaning our body can make enough. But in instances where a carnivore is eating a ton of muscle meat full of methionine, they don't have enough glycine to take care of the methionine. And if all of the glycine in the body is being used to neutralize the methionine, what about the glycine needed to make glutathione? You guessed it, it's going to be down. The liver needs glycine in order to make glutathione. And glutathione is your master antioxidant. So where do we get glycine? Bone broth. And we need to consume organ meats like liver. But here's another thing that I don't think carnivores, and this is maybe a recent learning opportunity for me because I had a patient a client, and I have seen this, and studies have shown this, that a person who's consuming a heavy carnivore diet full of muscle meat and even eggs and maybe some butter and some bacon and just the normal carnivore things, they are getting low levels of copper. And that would be the mineral I worry about as far as carnivores are concerned. Copper is needed for many things. But if we go down, if we back up, and I'm going to try to do this succinctly, if a person is supplementing with all these things, the triad that I really dig deep into is when we're taking D and zinc and C, because we've been told that those are good for our immune system. Well, they could be good for our immune system at the time that we have an immune shutdown, like we're sick. But taking them all the time, this triad of D, C, and zinc can actually lower our copper. Now, I'm not saying every patient out there or every client out there is taking these three things, but it's just one more way that our copper levels are low. If copper levels are low, we are going to drive iron into our liver and cause trapping. Now, when we are low in copper, we can have trouble with our hair. We can have trouble with our body temperature. We can have trouble with fatigue. Copper is very important. We need copper in order to keep iron, which is needed for every cell, in the right place. Okay? All of these minerals go hand in hand. You could even say that a carnivore, because their insulin level is low, they're spilling a lot of water. And with water comes sodium. So now that person is spilling out a lot of sodium. And when sodium is low, potassium does the opposite, okay? It tries to neutralize the positive negative charge. Potassium is supposed to be more prevalent inside the cell and sodium outside the cell. And when we mess up our sodium levels by it being carnivore and not consuming enough salt, now the potassium is going to try to, fix things. When we get low potassium, we get low magnesium. It's all of these things. You ask a question about the minerals. I just feel that when we are going to do, I'm not saying either one of these diets is unhealthy, because there are people on carnivore who are thriving. There are people on vegan diets that are thriving. They are getting the right, complete protein panels, the right amino acids, and they know how to do it, okay? But sometimes, we're human and we make mistakes and we're not looking. And we have vegan coaches out there. We have carnivore coaches out there. And they're, they might not know all these things. In fact, I didn't know all these things. I have to study, and I'm learning with you guys. But what the carnivores and the vegans can agree on is the people that are in the middle eating processed foods, seed oils, and sugars are really the unhealthiest people. Both of them can agree. So no division there. They both agree on those things, okay? Nin says, I would be a bit skeptical about any vegan thriving, but I do not doubt that they can be healthy compared to people on the SAD diet. And, Nin, I can agree with you, but I guess we have to agree on a definition of thriving too. I might say thriving, but, in my definition of thriving, is that real? Okay. Is it my kind of thriving, or are they saying they're thriving and they're just getting by. I don't know. It's subjective when I say thriving. So I do apologize if, it sounds like I'm, I know vegans. I have checked their labs and I have consulted them on their supplementation, but I'll have to admit, I have also done the same thing for carnivores. And without them telling me symptoms, and it could be something just, I'm not sleeping well or I'm cold all the time. When somebody says they're cold all the time and their thyroid is normal, I mean really normal, their TSH, their free T3, their free T4, their reverse T3, their TG, and their TPO are in an optimal range that I feel is optimal, I'm going to get a RBC copper level on that person because my instinct tells me that their copper level is low. And I can also get an iron study on them, an iron level, a ferritin level, a transferrin level, a TIBC, and a saturation, and I will see what looks like a pattern of iron trapping. Another doctor might say you're iron deficient. I am not convinced that there's any iron deficiency out there, okay? It's in the wrong place. You have dysregulation. If you're eating a sad diet, you have an overconsumption of iron. If you're on a vegan diet, you have overconsumption of iron, but it's non-heme iron. You cannot absorb it. So a lot of it's getting trapped. It's trapped and can't be used. So you go to the doctor and they tell you to take more of the thing that's causing your problem. And it's tough to get patients to understand that because they're looking at their hemoglobin and they're looking at their hematocrit and they're looking at their ferritin level and their iron level. And they say, doctor, I can see right here, I'm iron deficient. In all reality, unless you've had a bleeding episode or you're a female and you just had your period the days before and it was heavy, and then you got to ask, why was it heavy? Okay, why are you having crampy, heavy periods? Do you have iron overload? Are you trying to get rid of it? Okay. Chelsea asks, what about feet and hands ice cold all the time? Same thing, Chelsea. You are having trouble regulating your body temperature. Could it be thyroid? Absolutely. I would have somebody look into all of the thyroid hormones that markers that I mentioned. But I would get an RBC magnesium, RBC zinc, RBC copper levels, okay? You could have Raynaud's. That's a possibility, even though usually you'll see color changes of your skin with Raynaud's. But Raynaud's is related to copper. Raynaud's is related to iron dysregulation. What I would recommend, Chelsea, is I would recommend getting a thermometer, one of those digital thermometers. And every morning specifically, I would stick that thermometer underneath your axilla. So hold it there underneath your armpit and let that be a guide for your temperature. Okay? So if you are a person that's cold all the time, you could get your temperature anytime during the day, but getting that first morning before you jump out of bed, get that temperature. If it is less than 96.8 on a consistent basis, so like 3 times in a row, and you're cold and you just happen to check your axillary temperature during the day, if it's less than 96.8, your mitochondria inside are not working. You're not using oxygen very well. Your mitochondria are not making ATP. So your internal combustion engine is not firing. you're likely a person, and I don't know, but if you have cold hands and feet, I would ask, do you have increased amounts of belly fat or fat on your hips and thighs? You aren't going to burn that fat because you are trying to conserve energy because your mitochondria are not working. Okay? That just tells me that your mitochondria are bottlenecked and you need to look into it, okay? Prismos asks, are thyroid problems hereditary? Yes and no. I think epigenetics plays a more important role, and that goes back to our diet, Prismos. What are we eating that supports our thyroid? Are we getting enough iodine? Are we getting enough well, I guess the question to ask first is, did we get the right labs? When we check thyroid, you guys, make sure your doctor is checking a TSH, a free T3, a free T4, a reverse T3. It's a little r, big T3. Okay, we want to make sure that we're checking that. Also, a TG and a TPO. Those are antibodies to your thyroid. Okay. I truly believe that, could Hashimoto's be hereditary? Yes. So you'll have positive thyroid antibodies. But when we change our diet to an anti-inflammatory diet, a lot of times our antibodies will come down. I think it's important to check an iodine level, and it's important to check an RBC copper level, okay? Low copper, low glycine can cause problems with our thyroid, okay? What's a good way to introduce copper into our diet? Organ meats, the collagen and elastin, the bones, that's going to be important. But honestly, we need about 2 milligrams of copper just to take care of our normal processes in the day. And it's kind of hard to get enough copper through our diet. So, and I'm just telling you, the soil is so depleted now. So the foods that we're eating are low in everything, not just copper, okay? So with the fact that our soil is not good, sometimes if you know that you are low in copper, your copper level is low, you might be best supplementing with a copper level. If you were the girl who has the cold hands and feet and you start taking copper, 2 milligrams say, you will notice your whole body warming up. And it takes 3 or 4 days, okay? It takes 3 or 4 days for that to start kicking in. But you might notice it after the first dose that you actually start sweating. And I'm not talking a lot of sweat, because if you're the cold hands and feet, you're likely having troubles with sweating. And that is a problem when you're not getting rid of toxins. But increasing that mitochondria, the burning, the combustion engine inside, the fireplace inside, you'll notice with copper supplementation. You have to be careful if you take it, which it works best on an empty stomach, but you have to be careful taking it on an empty stomach. It'll cause a nausea. You might want to get, I believe it's copper bisglycinate. It might be copper. Thorne makes a really good brand of copper. Okay. I drink water out of copper. I drink water out of copper. I don't understand what you're saying. D-Money says, thank you so much for your time and insight. See you next time. Okay. Let's see. Oh, you're welcome, Tanya. Thanks for being here. Jack says, I'm carnivore. My LDL is stratospheric. Is there actually a level reached which is of concern even with an optimal triglyceride to HDL ratio. And Jack, if I recall, you exercise a lot as well, if I remember right, okay? Here's the thing. There is a certain subset of population that will be a carnivore, and they eat a pretty good helping of, my Instagrammers, are you there? There you are. No, you're not. Where are you? I'm looking for my Instagrammers. There you are. Hi, Instagrammers. Okay, you guys are sitting over there quiet. If you are a subset of population who's eating carnivore, you check your labs and the LDL is sky high, yet your triglyceride to HDL ratio is less than 1, and your insulin is in a good range of 3 to 5. So check those things, Jack, first. Sounds like your triglyceride to HDL ratio is less than 1. It's optimal. Then check your insulin level. Is it in the range of 3, 4, or 5? If your insulin level is low and your triglyceride to HDL ratio is low, yet your LDLs are sky high, you need to look into that, Jack. You need to get what is called an NMR, a nuclear magnetic resonance imaging of your blood, looking at the particle size, because Jack could be the very person who has a heart attack on a carnivore diet because his LDL is very, very high, and I will look at his small, dense LDLs, and his small, dense LDLs will be high. And this is a double-edged sword because usually carnivores who have a low, less than 1 triglyceride to HDL ratio and a low insulin, their small, dense LDLs should be low. They should be low because what raises small, dense LDLs more than anything? Great, you know the answer. It's carbohydrates. Carbohydrates raise small, dense LDLs. Carbohydrates raise triglycerides. So you would assume that since Jack's triglycerides to HDL ratio is less than 1, his small, dense LDLs should be low. But if you check an NMR on a certain subset of a population, their small, dense LDLs will be sky high. Why? They are a person whose liver has their LDL receptors downregulated. Let me tell you the process, and I'll make it simple, because if I go in deep on how everything works, it's just gonna overwhelm you. But if we think about this, that LDLs that are in our bloodstream dump things off. They got in an LDL that's a low density lipoprotein. Lipoprotein. They are a protein, and they have fat inside. They have fat and cholesterol, and they deliver their inner contents, their cargo, wherever the body needs it. And all the organs, the skin, wherever an LDL delivers its cargo, it dumps it off, it gets smaller, and then HDLs are the transport back to the liver, okay? The liver, who pumped out the LDLs to dump off the cargo, are full. The liver is full. You're taking in a lot of saturated fat that the liver has to deal with. It's pumping out a bunch of LDLs, and then those LDLs go out, do their job, release their cargo. HDLs deliver them back to the liver, and they say, hey, liver, here's some more. And the liver says, sorry, Mr. HDL, I don't have any more room. The person's eating a lot of saturated fat, and I can only deal with what they're taking in. So the LDL that's out into the bloodstream has a chance to get oxidized. Those LDLs stay in the bloodstream longer and end up becoming small and dense. Small and dense LDLs are at high risk of getting oxidized by whatever oxidizes things. It could be sugar, through glycation. It could be smoking, alcohol, nanoplastics, whatever it is going to affect that small dense LDLs and damage it. And then along comes a macrophage and swallows it up and causes a foam cell. And that foam cell makes for high risk of plaque formation in an artery. So what does a person like Jack do if his LDLs are high, triglycerides are low, HDL is equal to triglyceride or higher, and insulin is optimal? You get an NMR, the small dense LDLs are very high. What you do is you tell Jack to lower saturated fat, less butter, less tallow, maybe switching over to leaner sources of meat, like sirloin instead of ribeye, like 90% ground beef instead of 73 or 80 or 85. And then you add in monounsaturated fat to make up for what saturated fat you took out. Remember, this is a subset that's very rare, okay? Jack could be that person. And if Jack doesn't know this, Jack is at risk of a heart attack because of the small dense LDLs, even though they are metabolically sound. Low insulin, low blood sugar, low triglyceride to HDL ratio. It's a setup, okay? It's a setup and it needs to be looked into. But simply lowering saturated fat intake and increasing monounsaturated. What are those things? Maybe lard, which is, I think, nearly 60% monounsaturated fat, lard fat, because he's carnivore. Jack doesn't want to eat avocado, and surely Jack is not going to eat any olive oil, any oil for that matter, especially olive oil that has been cut with seed oils, which most of them have been. They're not real. So Jack says, I'm not eating a plant. I'm not going to drink olive oil and eat avocados. I'm against that. I'm carnivore. I want animals. That's it. Then Jack needs to switch his saturated fats, some of them, maybe half. He still wants to get 200 grams of fat, but maybe he needs to lower his saturated to 100 and do 100 of monounsaturated. And he can do the lard and he can do duck fat. And those are easy fixes to increase monounsaturated fat, and then just check an NMR in 3-4 months and see if there's improvement. Now, what if Jack gets bamboozled and his doctor says, you need to be on a statin? Well, let's think about what a statin does. Statins lower all LDL, all LDL. It'll lower small dense LDLs, but it doesn't say, statin doesn't say, I'm only going to get rid of the bad guys, the bad LDLs, which are the small dense LDLs. No, it's going to get rid of some of your good LDLs too, the big buoyant ones that you need to deliver the cargo. But you've gotten rid of them. You also need LDL and cholesterol to make hormones, to make CoQ10, to make vitamin D, all of these things, okay? So by taking a statin, you lower all LDL, and guess what? You also lower HDL. Not a lot, but you're lowering the guys that reverse transport everything back to the liver, the cleanup crew. You're lowering not only the bad guys, but the cleanup crew. Also, statins increase insulin resistance. So now Jack is at higher risk of diabetes. Statins increase diabetes. The very thing that Jack is trying to avoid by going carnivore, he now takes a statin because his ears got tickled and he got bamboozled because he was scared and they used fear. And now Jack is going to take a statin. So if he's getting diabetes or is pre-diabetic, guess what happens to liver fat? Well, first of all, what happens to blood sugar? Goes up. Insulin goes up, liver fat goes up, visceral fat. You're going to start depositing fat inside the viscera. And visceral fat is known for secreting a hormone called PAI-1 inhibitor. PAI, plasminogen activator inhibitor 1, basically blocks our ability to break down clots. Now, Jack started a statin and he has a heart attack because the real cause of heart attacks is clot formation. Clots, not LDL. Are small, dense LDLs found inside the plaque? Absolutely, they're very sticky. But we could go into the, how plaquing starts. We can go into that today. I have no problem. I love talking about it. But right now, Jack is worried about his sky-high LDLs. And the first thing that Jack needs to do is check an NMR and get a calcium scoring test, okay? If it's 0, awesome. But that doesn't mean that those small, dense LDLs are not contributing to an injury to the lining of the arteries, okay? Things injure the lining of the arteries and cause an injury. LDL does not do that. What causes injuries? Smoking, alcohol, sugar, insulin, anything that causes inflammation. Smoke in the air, diesel fumes, environmental exposure, nanoplastics, all of those things can cause an injury to the lining. Now, everything is fine and dandy if the body repair can take care of the injury. But if you continue to do it, like eating sugar all day long, then your body can't keep up with the repair. That injury is going to occur. And then a blood clot wants to form to bandage it over and allow healing. Okay? So this is your artery, and this is the inside of the artery in here. Okay? The innermost layer is the glycocalyx. You got an artery. The innermost layer encircling that artery is the glycocalyx. It's a very slippery, gel-like layer that's very protective, but it can be injured. I mean, high blood pressure can injure the glycocalyx, okay? Now, if the glycocalyx is injured, we have a chance to injure the endothelium because that's the next layer inside. So the innermost layer is the glycocalyx, and just inside that is the endothelium, and it's only one cell layer thick, and those cells can get damaged. So what occurs is a blood clot forms, and that blood clot forms over the glycocalyx injury. Now, the endothelium, and think about this. If the glycocalyx gets injured and a clot forms, and you continue to injure that area, a clot and a clot and a clot forms, right? Remember, a clot is soft plaque. It's not going to be picked up on a calcium score. That's hard plaque. Now, picture this clot on the inner aspect of your artery forming, hopefully being degraded, okay? But let's say it's not, because there's just constant injury and constant inflammation. That endothelial layer was getting its oxygen and blood supply from the flow of blood, right? The flow of blood inside here fed the endothelial cells. But if you got that big clot forming, now the endothelial cells don't get any blood and oxygen. No nutrients are coming to that endothelial cell. So the endothelial cells do not want to die. So the I know this sounds crazy, but on the very outside of the artery, it has its own blood supply, okay, called a vasovasorum. Crazy. It's just tiny little blood vessels that should be feeding the outermost layer, okay? But when the endothelial cells in here are choking and suffocating, they're asking the outside guys to give them some blood flow. And that that clot also needs nutrients to keep itself going. So these outer vasovasorum starts creeping in and make a blood flow, but those little arteries are so weak and easily damaged that they break and explode their contents. And now you have red blood cells spilling into the inside aspect of the clot. This is really hard to explain, you guys, but I'm trying to walk you through this. But now your endothelial cells are suffocating from the inside and they're asking for an outside blood supply. But that outside blood supply really can't keep up. They're weak arteries or capillaries, and they break, releasing even more blood cells into that clot. And guess what red blood cells carry? They carry free amounts of cholesterol. So is it the red blood cells that carried the LDLs and the cholesterol to the clot? And that's why they found LDLs in is that how the LDL hypothesis started? I mean, it's crazy to think. But I truly believe that it's the thrombotic theory of coronary artery disease versus the lipid hypothesis of coronary artery disease. But nonetheless, Jack with high LDLs and possibly high small dense LDLs puts Jack at risk of this whole thing that I just described accelerating his heart attack risk. His small dense LDLs are not going to be the cause. This whole thrombotic thing is what is the risk of heart attacks and strokes. Now, here is where I'm going to throw a wrench into things. Statins. Statins, actually, if they had one or two good things going for them, it's that they are anti-inflammatory and antithrombotic. So, with that being said, what do you do? I say, in Jack's case, he wants to be carnivore. I'm not discouraging his carnivore-ishness. I'm just going to say, Jack, let's lower the saturated fat. Let's increase the monounsaturated fat, okay? And let's recheck. Let's recheck your labs in 3 months with an NMR, okay? Okay. Jack, you're going to have to convert those for me because those are not American. So if you want to give us your LDL, HDL, and trigs, I only know U.S. Oh, Brad, that is a good question. Brad asked, what about nicotine for cognitive health? I'm not on board. Maybe I could say yet. Maybe I'm not on board yet. I know that there are certain doctors out there, and I actually follow them. When I say doctor, how about I just say healthcare provider? There are healthcare providers who have been studying nicotine for treatment of your brain, for treatment of other things, other neurodegenerative diseases. And I think it's an up-and-coming topic that I don't know enough about, so I'm not going to comment. And right now, I'm not on board with giving me nicotine and then go from there. Dead Wednesday says, thank you very much. You're very helpful. You're very welcome. Let's see. Dynamis says, yikes, Thorn is an expensive supplement. It is, but so's your health is very important to you, I'm hoping. So it might be worth it. You got to look at the way it's, I guess what you pay for, you would hope that the studies, that they're using good manufacturing and production. I don't know, Dynamis. Maybe you could get by with using Now brand or something like that, okay? Irfan says, I've got fatty liver, pre-diabetes, essential hypertension, how to reverse it. Those are all related. Your fatty liver, your pre-diabetes, and your essential hypertension are all related to insulin resistance, meaning you have hyperinsulinemia, high blood insulin. In order to lower your insulin levels and reverse your fatty liver, reverse your pre-diabetes, reverse your essential hypertension actually means we don't know what the cause of your hypertension is, but we do. It's actually insulin. That's the most common cause of essential hypertension. I don't know what caused your high blood pressure, insulin. So Irfan needs to lower their insulin. You lower your insulin by lowering your carbohydrates. That's how you do it. And you do some high intensity interval training and lift weights. Pouncing Puma, I would love to see actually what their iron studies show. I would also like to get a hepcidin level. I would also like to get a ceruloplasmin level. And I think with those things, with the iron, the ferritin, transferrin, TIBC, saturation, the hepcidin, ceruloplasmin, I'd want a CBC because I want to know the size of the red blood cells as well. And I also want liver function. Then I would see if they actually are iron deficient. Pouncing Puma says, I find this so interesting. I've noticed that these patients, about 1 in 5, are pregnant. And I'm guessing those pregnant people are on prenatal vitamins full of non-heme iron. 1 in 5 have a GI bleed. Back to the pregnancy. I would check that pregnant person and see how insulin resistant they are. Get a glucose tolerance test. Okay. 1 in 5 have GI bleed issues. But the other 3 out of 5 have unknown reasons for their low iron levels. It's starting to click, isn't it, Puma? It's starting to click, and you're starting to wonder about the doctor's diagnosis. Is it true? Yeah, Dynamis, I'm in Iowa. We're actually scheduled to get a blizzard starting this afternoon. Not very much snow. Blizzard is mainly blowing snow, but maybe 1 to 5 inches. Unfortunately, we had some rain, so now we got ice coating, and the temperature is supposed to drop down to 7 by tomorrow morning, 4 a.m., and then be 70 degrees 5 days later. And this is Iowa. And yes, it can get dangerous. it's not so much that the weather is that bad, but it's other drivers. And I know you got to watch out for the other drivers, but it really is true, you guys. Let's just say out of 5 drivers, you're the only safe one that doesn't really make you not prone to accidents, okay? Because they're all around you. And in Iowa, people love to go out in extreme weather just because they can, and they think it's fun and it's a challenge, and to really put their lives and other lives in jeopardy. And it's really kind of sad. If everybody would just stay in, and I know that sounds like a baby, but just staying in will avoid much of these, accidents that can occur. Crystal says, hi, hello, everyone. I'm from Las Vegas. I just landed here. So glad I did. Well, welcome, Crystal. Where are you guys listening from? What city, what state, what country? I'm interested to learn. Alpha 2 says creatine as well. I use it. So what are you using it for, Alpha? Because honestly, and I'm not sure, but if you were a carnivore and you're eating enough meat, you should be getting enough creatine and carnosine and carnitine. You should be getting those things. So why aren't we getting enough? Or are we? And studies are indicating that we need more because we're trying to offset the metabolic compromise that's going on in our body. People say, well, this is what we've always eaten and we should get by. But if you're a carnivore, the animals of today are not like the animals of previous. And what they're eating is not as good as what they ate before compared to what they're eating now. The soil sucks. Now, regenerative farmers are trying to change that. Praise the Lord. But I worry about my vegan patients, vegan clients, or my vegan friends out there who rely on the things that grow in the ground. And they are also consuming a lot of oxalates and phytates and tannins and saponins, and these decrease the absorption of amino acids and calcium, magnesium, selenium, zinc, iron, copper. They're decreasing the absorption of all the positively charged ions. Even if they take in enough, they might not get enough. Does that make sense? They take in extra, but it might not be enough because the soil is so depleted. Again, I guess it's one more reason that we should be checking these labs instead of just shooting from the hip and taking these medicines, okay? Margie is listening from Calgary, Alberta in Canada. Thanks for being here, Margie. I'm guessing you're an hour ahead of me, so you're Eastern Standard Time, I'm guessing. Mona Lisa says, what is the best way to fast when you have a history of gallstones? It's not so much the fasting, it's if you have a history of gallstones, that tells me that you had sludge, and the sludge got really thick to make gallstones. The reason you got sludge is because your bile acids got stored in your gallbladder, and the gallbladder never was active. So we get sludge and stones because we have an inactive gallbladder. That usually results from the fact that you were not eating sources of fat. When the gallbladder sees fat consumed and on board, it will secrete bile salts to emulsify the fats that you consume. If you don't eat fat, you're on a low-fat diet, or you're eating crappy fat, polyunsaturated fatty acids in the forms of alpha-linoleic acid, or linoleic acid, I should say, then your gallbladder is not working. If you fast, your gallbladder is still not working. okay? A person who has gallstones needs, I would recommend, or you, how about this? Mona Lisa should consider a low-carb diet, okay? And slowly increase the amount of fat that Mona Lisa is consuming in order to start triggering or knocking on the gallbladder to get it to wake up. It's sleeping. Your gallbladder has been sleeping for a long period of time. Now, you have gallstones. If you eat fat, the gallbladder is going to contract. If it contracts on a gallstone, it can shoot it into the duct and you'll have a tremendous amount of pain, okay? So it might be something that Mona Lisa wants to look into, a gallbladder crusher, a supplement with some sort of citrate that would help break down the gallstones she has. But over time, on a carnivore diet, most gallstones start shrinking. But for somebody with this concern that their gallbladder's been sleeping for a while, they've got gallstones, the fat needs to be spaced out in their day, maybe 4 or 5 times a day, so their gallbladder wakes up slowly and doesn't shoot one of those gallstones into the duct and cause a lot of problems. Oh, you're on mountain time. Okay, so you're gotcha. Okay. And we got a Delaware listening. Thank you. Coffee Drinker says, are there any food items or supplements that increase insulin sensitivity? Sure. So what I'm hearing you say is that you would rather take a supplement or a food item to increase your insulin sensitivity rather than removing the things that are causing insulin resistance. That's what I'm hearing you say, okay? It might be best for Coffee Drinker to remove the things that are causing insulin resistance so you don't have to take a supplement to increase insulin sensitivity, because the very things that help with insulin resistance will actually increase insulin sensitivity, okay? And a supplement program is what I consider an exercise program. That's supplementing your lifestyle with an exercise routine, lifting weights, increasing muscle. The more muscle you have, the more insulin sensitive you are, okay? You can do high intensity interval training that releases a chemical called BDNF, brain-derived neurotrophic factor, and that will help your brain, and that will help you and your cognition for sure. So, gosh, you guys, these are good questions, and you're really stimulating my brain to work here. Susan is listening from Louisiana. Emma says, you're smart. Knowledgeable, well-read, smart. I appreciate your kudos. Mona Lisa says, are you familiar with carbon cowboys? No, never heard of it. They are doing experiments to prove how to improve soil through hands-off approach by moving cattle, not using sprays or hay or equipment. I'll have to look into the carbon cowboys. Maybe I have heard of them and I don't know it, but I think that's a wonderful plan of action, is to improve our soil. We've destroyed our soil, especially in Iowa. We are a monocropping state, and I am guessing that our topsoil used to be 8 inches, and now it's a half an inch. That means we are destroying everything simply because the government, maybe the state of Iowa, is paying the farmers to continue. So they subsidize them to continue to produce corn after corn after corn, and maybe a soybean in there. And so we say it's okay because we're giving gasoline to people, or we're giving corn to other nations, and we're making food out of it and supplying the millions of people who are going hungry. If that was true, why are people still going hungry? At the same time that we're trying to prevent people from going hungry, we're causing them to get diabetes. Then we feed our land full of glyphosate and that other one that starts with an A, I can't remember the name. We're destroying the atmosphere. We're destroying, by monocropping, animal populations, deer, rabbits, all the way down to the snails. We're destroying them, killing them, all in the name of monocropping, all in the name of money. I've lived in this state much of my adult life, and it wasn't until recently when I started learning about the soil that I start getting more and more frustrated. And it has nothing really to do with what I consume, because I'm going to consume what I'm going to consume as far as my diet is concerned. But it frustrates me in other areas of my life. And the farmers, I know, need money. And if you were to transition them to a regenerative farm, they would go bankrupt. But you don't do it all in one foul swoop. You might fence off a certain amount of area and start from there. But they don't even want to try. They're in way too deep. And so does the government stop subsidizing? I don't know the answer, you guys. Please feel free to overwhelm us with your information. Even if it gets quite technical, you are very well informed and very much appreciate this channel. Thank you for letting me know that. I try my hardest, my darndest, to keep it as simple as possible. And I know that up here swimming in my brain is a whole bunch of information. And I need to get better at laying it out in an organized way that's easy for you to understand. But when only a few questions come in on a subject, it gets my brain rolling, and I end up spilling out all of the information that's sitting here. And maybe part of it is I should stick to topic of what the question was. But in order for me to explain the topic in the detail that I want to, then I vomit all the information that's inside my head rolling around. So I do apologize. Aussie, if you have to ask a question like that, honestly, I really don't need you on here. That's just not a good, thank you, Dimista. I don't know if that was to you or me, but either way, that question was not appropriate. So thank you. And, I guess we get rid of that person. JB says, I love when you spill out information. Don't apologize. That's when you get the best info. Okay. Well, I'll keep going, but I will try to just make it a little more understanding. Okay, Jack says, thanks, doctor. NMR it is then. Good. And maybe a calcium scoring test. Crystal, thank you. Appreciate that. All right. Any other questions? Okay, as a review, we started out talking today about health. We talked about healthcare in terms of mental health, okay? Mental health, just like any other chronic disease, as doctors, as the healthcare system is concerned, we are simply medicating people and not looking into the underlying cause of what we're treating, okay? If it's obesity or diabetes, we hand them a GLP. If it's blood pressure, we hand them an antihypertensive. If it's depression, we hand them an antidepressant. We are in the business, and very well educated business, mind you, okay? We are very well educated as far as what medicines do we use to treat a chronic disease. It takes a lot of reading and understanding to know what is the best medicine to treat your blood pressure. Do we use an ACE inhibitor, an ARB, which is an angiotensin receptor blocker? Do we use a calcium channel blocker, a beta blocker, an alpha blocker? We have to be really educated in the best choice of antihypertensive, okay? Same with diabetes. We have to look at their panel and decide, are they a metformin person? Are they a Jardiance metformin person? Are they a GLP person? Are they an insulin person? I hope not the latter, okay? But we have to make those decisions, and that takes a lot of education. What we were never educated on is we diagnose your high blood pressure, we diagnose your mental health problem, we diagnose your obesity, but what is the cause? Do you want to fix the cause? Now, most buyers or consumers of healthcare, because they've been bamboozled for so long and they have so much cognitive dissonance, they reach for the pill. So they're actually cultivating the very thing that a doctor does, which is make a diagnosis and write out a prescription. But you guys, the ones listening to me, and not just me, but other healthcare providers online who are working at finding the causes of the things, the causes of the diseases, you guys are in a better position to fix you. So the best doctor is the one looking back at you in the mirror. My mission is to give you enough information that you can make good decisions. If I provide you with truthful information, you can take it to your doctor, because I'm not your doctor. You're not my patient. This is not medical advice. It's for information purposes only. And you're going to use that information to have a good conversation with your provider. And in that conversation, you're going to ask politely for some labs or some tests that would help you and doctor discern what is going on. But if you don't take any initiative in your healthcare, you're basically giving the reins to the doctor. I always bring up, when I talk to people, I ask them, would you give the reins up to your legacy, your financial legacy? Would you simply say, here's my $1 million. I trust you. Do what you want. And to help me, do you trust them? Or do you say, you know what, here's my investment, and I want to watch what you're doing, and I need you to explain what you're doing, because I want to make sure that my fees are standard. What fees are you charging me? I also want to know my tax issue. Are you going to increase my tax debt or decrease my tax? Are you going to invest in such a way that protects me from getting taxed even more? Are you going to watch my capital gains and my capital losses and make sure that they even out at the end of the year? See, you would ask all of those questions. I hope you wouldn't just give your money to somebody and say, hey, there you go, I trust you. But yet you'll do that with an even more important part of your life, which is your health. And you simply just trust your doctor. And I was amazed when a patient would say, you know, Dr. J, I trust you. Whatever you think, let's just do it. I go, no, don't do that. Don't just blindly trust me. Let's talk about this. Let me give you some information, then I'll ask you some questions. A financial advisor should do that too. They ask you some questions. How do you feel about giving me $1 million? And there's a chance if the market goes down, you'll lose half of it. But if the market goes up, you'll get another $1 million. So you could look at, if the market goes up, at $2 million, Or if the market goes down, $500,000. Which is more important to you? Preserving what you have, or do you want the win? Now, if the financial advisor asks you the right questions, gives you the right information, then you can make a good decision. And you say, no, I like to preserve what I got. I don't like to lose, but I don't need a big win. I don't need a home run. I need you to protect me for the long term. That might look like some ETFs. It might look like some bonds. It might look like some stocks. It might look like gold and silver. I don't know. But again, I just don't think you guys listening will just hand over your $1 million and say, I trust you. Good luck. No, because they could be charging you 2% on your money. You don't want that. You don't want to pay somebody 2% to manage your money and you could lose it all. And you don't want them selling you some annuity with a front load that they can pocket 10 grand on. You wouldn't just give them 10 grand to manage your money right up front, would you? So the thing is, you guys, educate yourself, do reading. When I pick a topic that I really want to learn about, I dig in. I mean, dig in and go deep. I'll pick YouTube videos. I will read books. I'll do whatever it takes. Like the Jack scenario. Jack's scenario was, he's carnivore. He's got an HDL, or excuse me, a triglyceride to HDL ratio that's less than 1. His insulin is between 3 and 5, yet he's still got this weird feeling that his LDLs are so high. What if that really is bad? So if with the Jack situation, he digs deep, goes down rabbit holes. And then he starts going, boy, Dr. Jensen is right. I could be in the subset of population that has high, small, dense LDLs. And I could be the carnivore who's been doing this for 10 years and then have a heart attack, when I'm supposed to be at the least risk for a heart attack, because it's the person with the beer belly that has the highest rate. And I don't even drink beer, nor do I eat carbs or fruit, which is the highest causes of beer bellies. Yet I had the heart attack. I mean, that's embarrassing. And it's scary. Yeah, Tanya, research is so important. I agree. Ask the right questions. Right on. Ask the right questions. But you guys, you have to know what questions to ask. Okay? Crystal says, no, I would not give my money away without investigation. Okay, Crystal, if you won't give your money away without investigating, will you give your health away without investigating to the doctor? Because she sounds like a really nice person. She's so sweet. She always asks about my family. Everything's just so nice. She's such a nice person. She's got a family. She's just normal. I don't care. Where's her intelligence? Is she doing in your best interest or her best interest? Is she protecting herself or is she protecting you? Because there are ways that doctors protect themselves from getting bad press. Okay? Okay. Let's see. Susan says, I appreciate you and looking forward to your weekend lives. Yeah. Every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. Hopefully, even if there's really bad weather. Right? This morning, I usually go work out before these live streams. I usually work out in the morning anyway, on an empty stomach. So I've been fasting. I have a cup of coffee, so I guess not. And I had a little hitch in my giddy up this morning, meaning like right under my right rib area. It was almost like if I coughed or sneezed yesterday, don't remember, and now I have a little catch in my giddy up. So today I decided not to go work out. I'm sure the people at the gym will wonder where I'm at and if I actually died, because I would venture to guess for the whole year, I probably will have missed 5 days total. I know that's not good. I like to go every day, even if I'm just going to walk. It gets me out of the house and into a situation that helps my well-being. So, Christian says, cheers from Italy, old wise Linus, free healthcare in EU, team Luigi up. I think that's a compliment. Okay. I keep missing your lives. Well, if you know the time, you won't miss them. 9 a.m. Central, Saturdays, 10 a.m. Central, Sundays. Mona Lisa says, I also have GERD in addition to gallstones. I've been taking ursodiol for a year, been very bloated, eat 4 to 5 times a day. I suspect my gut biome is off. Okay. Mona Lisa, this is an opportune time for me to suggest to you that I offer consultations. Just email me at ironladydoc, IRONLADYDOC, ironladydoc at AOL.com. Sign up for a consultation. It's well worth your money. We can go over your medications, your diagnoses, your lifestyle, including your diet and your exercise, and we can form a plan of action that you can talk to your doctor about. But you having reflux, if you want to go back to last Saturday's live stream, I opened the topic of GERD, gastroesophageal reflux disorder. So you can learn all about GERD from last Saturday's live stream, but maybe you consider a consultation, okay? So email me. Yes, Central Time Zone. Good to know. I'm glad I caught this. You're very welcome, Tanya. All right. Oops. Trying to read this. Margie says, ask the right questions for sure, but I find there is so much pushback from doctors I've dealt with, asking them to refer me to specialists or even asking to pull labs. They won't more than once in a year. You might want to save your money and order the labs on your own. Insurance will not pay for it unless, of course, if you have an HSA, health savings account or something similar, you could get the receipt and turn it in, and hopefully they would pay for your labs. This is your health. I know it is expensive. I mean, just labs that I routinely check for you guys are around $355. And that gives a good amount of labs that I can look at. Does it give an NMR? No, but for an extra $25, you can get an NMR. Begging your doctor shouldn't be the case. It should be a team effort. But what you're describing to me is a paternalistic doctor where what they say goes because they're in control. That's paternalistic, or maternalistic if it's a female. So they're basically in control of your healthcare. Whereas you want an integrated healthcare where you have a conversation with your doctor, you decide on a game plan together, you have knowledge, they have knowledge, and you meet in the middle and you decide, yeah, that's okay, that's a good idea. Or, no, here's the deal. If somebody came in and asked me for labs and I didn't know what they were talking about, I would tell them that. I'd say, okay, I'll order your labs. But you don't, as far as I know, you do not have a diagnosis that pays for it. So insurance isn't going to pay for it. And I don't know what these tests are. They will likely say, doctor, it doesn't matter. I will pay for the labs if my insurance doesn't. And doctor, you do not have to read my labs for me. You don't have to review them. Just send them to me. I'll do my own research. And then I say as a reply, do you mind signing a form stating what you just said? And they say, of course, doctor, I would be happy to. That is the easiest integrated partnership that I think is the best. But doctors have their piggy banks involved as well. I worked on my own, okay? But when I was in a corporation, corporate medicine, for a big hospital, when we ordered labs, it came out of a pool. So we were actually paying for the labs. So if I kept the labs to a minimum, I would be saving the pool money. And if we all did that, we saved a pool. And then at the end of the year, we would get a bonus. That's not very good healthcare. Do you guys think that if I don't order your labs, I save money and I can get that money back at the end of the year? Now, do I know if that's going on today? No. So don't quote me on that. But that's the way it was back then. And if one doctor didn't do so good saving money, they kind of got asked to leave. We accept your resignation, doctor. I didn't resign. We accept your resignation, doctor. That's how that works. So it's a difficult situation that the doctor is in because they're thinking about paying back their house, paying back the car, and sending their kids to college. But when I did it, being on my own, I didn't have to worry about a pool. If you want your labs checked, I do your labs. And if I don't know what those are, then I just have you sign a form that says, I'm out. I'm out of it. You have relinquished me from reviewing your labs because I don't know what they mean. And then they sign their name, and I'm not held responsible. It's very easy. So I'm sorry, Margie, that you are dealing with a doctor who does not want to order your labs. And honestly, they are maybe claiming ignorance. They have a condition of ignorosis, a condition of ignorance. They really don't want to admit to you that they don't know what those tests are because they got an ego they're trying to protect. And I'm sorry that that's happening, but there could be other reasons. I don't know, but that's a likely reason, as well as the money aspect, okay? Let's see. The wind's starting to blow. I know you guys can't hear it, but it's like whistling out there. We're supposed to get 55 mile per hour winds. Let's see. Yeah, that could be Mona Lisa. They're thinking about paying back their loans. The doctors who went to state schools have much, much less debt than a doctor who went to a not state-sponsored school. Now, my medical school is now state-sponsored, but at the time it wasn't. It was a private medical school. And when I got out of medical school in undergrad, I was $200 and some thousand in the hole. And what I did, I didn't know anything about, saving money and bonuses and all of that. I just thought, well, I'll just work hard. I'll go do moonlighting. And moonlighting is basically you work during the day and then you work at night. So you could be working, 14, 15, 16-hour days. And that's how I made my extra money, because wherever you moonlight, they pay you pretty good because they don't have doctors on board who will want to work extra, okay? So they hire outside doctors to run their ERs or run their after-hours clinics, the walk-in clinics. And that's what I did. I did moonlighting, and I worked after hours, and I paid my loans back. But I would never do, it seemed to me, I can't even think about being unethical. It doesn't even cross my mind that says, I don't think I'm going to order that lab because if I order that lab, it's going to take $100 of my pool and I really need it at the end of the year. I just can't imagine a doctor thinking like that. But what could be happening is the pressure of losing their job could be worse than the money that they get back at the end. That's where, you know, they'll play the game as long as they can keep their job. That's really what's, you know, that's sad, I think. Okay. I see you guys that are chit-chatting back and forth, user and dial-up, and all of these people are chit-chatting back and forth. So if there's no further questions, okay. I guess do you guys want to take down each other's notes, Susan and dial-up and user? Do you want to take down their handles and stuff so you can get back to each other and finish your conversation later? Would that be okay, you guys? You better take your notes right now. Take your notes right now. Get your things so you can start talking afterward in case you missed something about your constipation and your oranges and bananas and all of that stuff and huge nuts and all of that. That would be awesome. Hoover says, is it possible to get off of thyroid medication? It depends on what's causing your thyroid problems. It'd be something to look into, okay? Oh, Susan, good idea. Why don't you screenshot that so you can figure out who dial-up is, and then you can contact them about your constipation when you get done here, okay? How's that? Same with dial-up, okay? Dial-up and Susan, and it looks like user. You guys all can get together and discuss your health concerns, okay? So Hoover, to answer your question, you know, I have seen people lower their dose. I have seen people get off of their thyroid medicine. I have, as long as it's not long-standing. I have seen some reversals and people are off their thyroid medicines. Kind of a halfway answer, I guess. All right? Okay, you guys. As a reminder, I am live Saturdays at 9 a.m. Central, Sundays at 10 a.m. Central. I do reels during the week on topics. I do consultations. If you're interested in a one-on-one to go over your labs, to go over your medicines, your diagnoses, we can review all that. We can review your lifestyle, your diet, and your exercise routine, and give you a plan of action. I think reading the labs, especially the first time, is a good idea to get you in the habit of looking line by line at every single one of the items instead of your doctor calling you up and saying, everything looks good. I'll see you in a year. Well, yeah, but what are the size of my red blood cells, doctor? Well, it just looks like everything looks good, so I'll see you next year. Not doing you guys any good, okay? Are there natural remedies for thyroid health? That would be taking things, that would be eating an anti-inflammatory diet, getting in the sun, exercising, being happy and hanging around happy people. All those things are natural remedies for your thyroid, but usually not damaging your thyroid with things that you eat or consume or breathe in the air. Okay? Tanya, you're a blessing to me too, so thank you for being here. Okay. All right, you guys. So, one more reminder. If you're like Margie and you're in the United States and not of one of the 7 states that I can't order your labs, you can email me and I will order your labs, or even email me and I will send you a list of good labs to ask your doctor for. Sometimes your doctor will want or will agree to order half of what's on the list. Then you only need to pay for the other half. Just let me know what they didn't order, and I can order those other labs at your cost. You'll have to pay out of pocket, but at least they'll have the results, okay? It might be worth you spending $100 or $200 to know a baseline of these labs. Now, I will tell you, the minute you start adding in red blood cell levels so RBC copper, RBC magnesium, RBC zinc, it gets quite expensive. I mean, quite expensive, okay? I have had orders for labs that went into the 700s, like 700 and some dollars. But they wanted their hormones checked. They wanted a lot of different things checked. But they were willing. They asked. I gave them or ordered the labs that they wanted, and they were happy. They were happy. And so if that makes you happy and you want those labs and you have $700, by all means, find out what your health is like, okay? Okay? So email me at ironladydoc@aol.com. IRONLADYDOC. ironladydoc@AOL. I know it's old, but I'm old. So AOL. Okay? All right. You guys have a wonderful day. Can you hear Talo in the background? Whoa, whoa, whoa. Talo, are you talking? See, just be quiet now. Oh, are you talking? Are you coming up to say hi? Can you guys see? Yeah, you can maybe see his head. Can you see? Can you say hi, Talo? Oops. Here's Talo. Talo's shy. Can you see Talo's been shy? Are you shy? All right, you guys. This is Talo. He's all caught up in the cords. But this is him. He's my talker. I'm going to bring you closer so you can see him. There he is. Uh-oh. Do you hear your sister talking now? All right, you guys. Have a blessed Sunday, okay? We'll see ya. Let me see where this... Okay, there you are.